The Knowledge Translation Unit is a health systems research unit based at the University of Cape Town in South Africa. We've been working for the past 20 years to develop, evaluate and implement the PAC program in low and middle income country settings. This 10-minute presentation provides an overview of what PAC is and how it can be localized to support a country's delivery of primary health care. PAC addresses the needs of the patient and the health worker in primary care. It aims to support the health worker who needs to attend to many patients every day, and many of these patients have multiple problems. But at the same time, we expect the health worker to comply with a plethora of guidelines, policies, protocols, updates, and essential medicines lists. PAC comprises two main elements: a clinical guideline and a training program. Health system strengthening is a key focus throughout the development and implementation of these two elements. The PAC guide is comprehensive, integrating all relevant policies, essential medicines lists and guidelines into one clinical decision support tool that can be used by every primary healthcare worker in every clinical consultation. The guide takes a symptom-based approach, featuring around 50 common symptoms. I'll use the patient presenting with a stroke as an example. She might present with collapse, dizziness, face symptoms, headache, a seizure, be unconscious, or have vision problems or weakness. Each one of these pages will prompt the clinician to consider a stroke. The symptom pages take a standardized approach, starting with a red box containing the signs that will indicate when the patient needs urgent attention, and then following with an algorithm that assists the clinician to decide what the likely diagnosis is and what the management or referral plan should be. The symptom pages also use the opportunity to identify underlying chronic conditions that require routine care. This collapse page, for example, includes the possible diagnosis of stroke, ischemic heart disease, pregnancy, mental health issues, and diabetes. The second half of the PAC guide contains common chronic conditions that require ongoing routine care at primary level. Each chronic condition page uses a standardized checklist format of assess, advise, and treat, which helps the clinician to structure their consultation. And once again, it uses the opportunity to identify common comorbidities. PAC training uses educational outreach to deliver PAC to clinicians as teams in their health facilities in the form of short 1 to 2 hour training sessions every couple of weeks. This allows for the alternation of learning with practice, making it easier to embed the use of PAC into each clinical consultation. The curriculum takes the form of case scenarios that are constructed to help clinicians navigate their way through the features of the PAC guide and to highlight clinical priorities. This waiting room scene of cases forms a central training tool. The PAC implementation strategy adopts a cascade model which utilizes staff already working in the health system as trainers, managers and clinicians to be PAC trainers. Master trainers train the facility trainers and manage the program implementation in their area. The facility trainers lead the on-site PAC training sessions and work to embed the use of the guide into everyday clinical practice. This model has allowed for the rapid upscale of PAC in South Africa, with over 30,000 health workers trained in 3,000 facilities around the country. The Cascade model also supports the ongoing maintenance of the PAC program as the guide is updated. Health system strengthening is a focus both in the development, update and localization of the PAC guide, as well as in the training program. One of PAC's core principles is to train the staff working in a primary care facility as a team. This approach provides opportunities to discuss care coordination within a facility and can also facilitate task sharing. The guide development, localization and update processes provide several opportunities to clarify health system features, including streamlining referral pathways, rationalizing the use of resources like equipment and tests, and clarifying and growing the clinician's scope of practice. This is best illustrated in the guide with medications being color-coded according to prescriber level. And there have been instances where the update of this comprehensive guide has helped to resolve policy inconsistencies and gaps. In 2015, the KTU formed a partnership with the British Medical Journal, and using PAC Adult in the Western Cape in South Africa as our starting point, we checked each of the roughly 2,500 diagnostic and management recommendations in PAC against the BMJ's evidence synthesis product, Best Practice. We also aligned the PAC recommendations to World Health Organization guidance, and this has allowed us to publish PAC Global Adult along with its evidence base. PAC Global is designed to form the template for low and middle income countries to localize PAC to their own policy environments, resource constraints, disease profiles, and health worker skill sets. In South Africa, the National Department of Health version of PAC is named Adult Primary Care. In Ethiopia, the Federal Ministry of Health have localized PAC to be the Ethiopian Primary Healthcare Clinical Guidelines. In Brazil, PAC Brazil Adulto is implemented at municipal level in the city of Florianopolis. And in Nigeria, PAC Nigeria has been piloted in several states. In each of the countries where PAC has been localized, the KTU has provided mentorship to an in-country team to localize the guide and training program. We have used an online project management tool that the two teams share to streamline the process of checking each PAC Global page against local policy, interrogating the PAC Global evidence-based reports when needed, and ensuring that the local PAC content maintains the standardized format and user-friendly features. Here you can see the black dots on the diabetes page are the numbers of recommendations that correspond to the evidence database report. Once the guide is complete, the case scenario curriculum is localized to reflect training needs and local health system issues. PAC has grown over the years into a suite of programs that provides consistent messaging across the packages, covers the life course, and addresses the needs of everyone in the primary care team, including the patient. PAC Child addresses the care of the child between 0 to 9 years. PAC Adolescent covers the care of the patient who is 10 to 19 years old. And PAC Adult, the care of the patient who is 20 years and up. PAC Community is a tool for lay health workers supporting the delivery of primary care. PAC Home contains health information and advice for the patient and their family. To learn more about how PAC addresses the needs of patient and provider in primary care, read the PAC collection in the BMJ Global Health Journal or visit our website at www.knowledgetranslation.co.za. You can also contact us at ktu@uct.ac.za.